The first 4 weeks after ACL surgery sets the foundation for everything that comes next. Get the stage right, and the rest of your recovery has a real shot. Get it wrong, or just guess your way through it, and you'll be playing catch up for months. The challenge for most people is that they're not exactly sure what right looks like in this phase. What exercises should you actually be doing? How often? How many? And what is each one supposed to do for your knee? That's exactly what this video is for. I'm walking you through a complete sample session I'd run with one of my online clients in the first month after ACL surgery. The exact exercises, the exact dosing, and most importantly, the why behind every piece. If you don't know the target, you don't know if you're hitting it. The goal of the first month is to build what we call a quiet knee. Reduce swelling, minimal pain, quality quad activation, and full symmetrical knee extension range of motion. If you want a full breakdown on each of those 4 targets, what they should look like, how to measure them, and the milestones you need to hit, check out my video on how to crush the first 3 months after ACL surgery. I'll link it in the top corner and in the description below. This video is the how. That one is the why. Watch them together and you'll have the complete picture. Every exercise in this session is engineered to chase one or more of these 4 targets. Nothing is filler. Now, this isn't where someone stays for a month. We obviously progress them here as appropriate. But this lays the foundation in the first few weeks after surgery. Let's start the session. So we're going to start with ice on the knee for 10 to 15 minutes. Yes, before exercising. And we're going to combine this with heel props, which we will cover later. So I'm going to prop my heel on a chair, a coffee table, anything so that there's nothing underneath my knee. Then I'm going to place ice directly on top of my knee, right? Now, if you have access to a TENS unit, right, an electrical stimulation unit, we can add that on top of it. So just place the electrodes on either side of your knee, and then you're going to turn the intensity up on the machine until it's as strong but comfortable. And now most people think that ice is just for swelling and that it should be done after exercise. That's part of it, but in the context of an ACL injury, that's not the main reason why it's here. After surgery, your knee is healing. It's irritated. And that sends a signal to your brain, right, from your knee to your brain, that essentially tells your quad to stop firing effectively. The fancy term here is arthrogenic muscle inhibition. Your knee is shutting down your quad as a protective response, kind of like dimming the lights on how well your quad fires. So when you go to flex your quad, it doesn't fire the way it should, right? And it's not because the muscle is gone, right? You're gonna lose some muscle mass, but it's more so because the nervous system isn't letting it work, right? So ice and TENS help calm that down. They give the quad a window of opportunity to actually turn on. So that when we get into the quad work in a few minutes, you're not fighting your own nervous system the entire time. This is the warm-up, 10 to 15 minutes, then we move. Now we go after the most important early milestone, full knee extension, range of motion. Start by sitting with your legs straight out, and you're going to take a small towel roll and place it underneath your knee. You're going to take a strap or a towel and loop it around your other leg like this. First and foremost, actively press the back of your knee down into the towel. You have to think crush the towel at all times by contracting your quad. This is critical. Next, place one hand on top of the knee to gently pin it down. You're going to use your other hand to grab the towel and pull your heel off the ground as your knee goes into full knee extension. Now, your hand and the strap or the towel is doing the passive piece, gently pulling into more extension, and the quad squeeze, crushing the towel, is doing the active piece, teaching your knee to own that end range. So why does this matter so much in week 1? Because the further out we go from surgery, the harder extension is to get back. And we're not chasing close. In the vast majority of cases, we're chasing full symmetrical knee extension compared to your non-surgical knee. Yes, even if your other knee hyperextends. That's the target. Noel and colleagues published a research paper showing that knee extension at week 4 post-surgery was strongly correlated with extension loss at week 12. So what you do now sets the ceiling for what your knee looks like in 2 months from now. That's why this is non-negotiable. Here's the dosage: 10-second holds, 10 reps, 3 to 4 times a day. And if you have access to a neuromuscular electric stimulation unit, an NMES unit, stack that on top. NMES forces the quad to contract harder than you can voluntarily, which is going to accelerate the activation work. Same exercise, slightly different execution. Place a small rolled up towel under the knee and think about crushing the towel with the back of your knee. If you can get your heel to hang off of the support surface as well, even better. Combining this with the rolled up towel underneath your knee is non-negotiable. Why? Most people, when they're first trying to do a quad set and contract their quad, straighten their knee, right? They fire their hamstring at the same time. This is called a co-contraction, and it's a compensation for poor quad activation. So what happens? They try to do the quad set and try to straighten down, but what happens is the hamstring kicks on too, and there actually becomes like a tenting effect underneath the knee where the knee pops off of the ground. When in reality, we want the knee to go straight, right? So the small towel roll gives a tactile cue to increase quad activation while minimizing hamstring recruitment. This is what specificity looks like. It's not just do quad sets. It's do quad sets this way so you actually get a quad contraction instead of your hamstrings sneaking in to bail you out. If you have an NMES electrical stim unit, definitely layer that on this one as well. So what's the dosage here for these quad sets? 50 reps, 4 to 5 times per day. Yes, 50. High volume, high frequency. This isn't a strength exercise. It's the wake the quad up exercise. And when you wake up a sleeping muscle by talking to it constantly, not by doing 3 sets of 10 and walking away. Now we add load to the quad. A yielding isometric is when you hold a position against resistance. Your quad is firing hard, but the joint isn't moving. So you can do these seated or you can do these laying down on your back, right? The ideal position for your knee is going to be at 60 or 90 degrees of knee bend, right? Depending on what your flexion motion allows at this point. Why those angles? Because that's where the quad has the most leverage and the ACL graft is under the least amount of stress. So you can really go after the quad while putting minimal stress on the graft. So you're going to kick your leg out until you get into that position and then hold it. You may need to start with only the weight of your leg for now, which is fine, but you can progress this by adding either an ankle weight or using a resistance band. This is a sustained contraction, right? So it's low joint stress. It's a win-win. This is where we bridge from just wake the quad up to actually make the quad work harder. First step on the strength ladder. Now, if you have an NMES unit, layer it on this one too. So we're looking for a 60 to 90 second hold, 4 sets. These are going to burn, and that's fine. The burn means that it's working. And if it doesn't, the resistance isn't enough. Now we're going to shift gears and go after flexion motion. Extension is the top priority in this phase, but flexion still matters. Ignore it completely in the first month and you're going to hit a wall later when you try to squat, walk normally, use stairs, or get up out of a low chair. Heel slides can be done lying on your back, sitting up, or sliding your heel up and down a wall. Whichever one feels the best for your knee, that's the one you're going to use. With a strap, a towel, a belt, right? Loop it around your foot and start by actively sliding your heel towards your hip. Now you're going to use your hands to pull on the towel to give yourself a gentle assist. Take this until you feel a tolerable stretch or slight discomfort in the knee. The key is to make sure you're getting into the tightness, but you're not trying to be aggressive and crank on. Shoot for 30 reps with a 3-second hold at end range, 3 times a day. This is the unsung hero of early ACL rehab. You prop your heel up on a coffee table, a chair, an ottoman, anything that elevates your heel and allows your knee to just hang in the air, right? There's nothing under your knee, just there. The heel is propped, the knee is unsupported, and gravity is doing the work. And here's the magic, right? This exercise gives your knee long, sustained time in extension. And total daily time in extension is one of the biggest factors in actually getting that range back. So quad sets are short, focused bursts. Heel props are the opposite. They're long, low intensity exposure. Both matter. You can relax during these, or you can mix in some quad sets, right, where you push down, contract your quad, to get in some active component in that as well. Now, once your pain is manageable, you can add a bag hang, a small bag with 2 to 5 pounds hanging from your knee, or place a weight, again, 2 to 5 pounds works well, just above the knee joint like this. That's the progression. Start with 5 minutes as tolerated, building up to 10 minutes per session, 3 times a day. The amount of total daily extension exposure you bank from heel props is hard to replicate any other way. That's the session. 6 pieces stacked in a specific order, each one earning its spot. Look at the structure. We calmed the knee down with ice and 10 so the quad could fire. Then we went after extension and quad activation with strap-assisted quad sets with a towel roll, and yielding isometrics. Then we addressed flexion with heel slides. Then we banked long-duration extension exposure with heel props. Every piece is pulling you towards the 4 targets, the quiet knee. Nothing cute, nothing fancy, just the raw basics done well. Compare that to what most people are getting in a typical clinic. Some massage, a few quad sets, some heel slides, maybe a bike, done. No specific dosing, just 3 sets of 10 forever, and no education of why each piece is there. It's a checklist, not a plan. The gap is why I see so many people come to me at 3, 6, 8 months post-op, still missing extension, still dealing with a quad that won't fire, still stuck. Time means nothing if your knee isn't ready. And your knee gets ready by stacking sessions like this one every day with intention and progression. 2 quick reminders. This is a sample, not a prescription for your knee. Your specific situation, your surgery, what your knee can tolerate, and any other procedures all change the details. And none of this actually matters if it's not being measured. Track your swelling, measure your range of motion, assess your quad activation. If those numbers aren't moving in the right direction, the plan needs to change. So if you're getting ready for ACL surgery, or maybe you just had it and you want to do this right the first time, this is the time to lock things in. Or if you're already months down the line thinking, I never did anything like this in my early rehab, that's not a reason to panic, it's information. It tells you why your knee feels the way it feels, and it tells you that the foundation is fixable. I work with people every week who are months or years out who finally get the right plan and finally start moving forward. In either case, I'm here to help. Click the link in the description to book a free call with me so I can learn more about your situation and see what's holding you back. And if this video was valuable, hit like, drop a comment letting me know what stage that you're in, and subscribe for more ACL recovery content like this. I'll see you on the next video.